Prednisone is a corticosteroid medication that has been widely used in the medical field for decades. It is a synthetic version of the naturally occurring hormone cortisol, which is produced by the adrenal glands. Prednisone is prescribed for a variety of conditions due to its potent anti-inflammatory and immunosuppressive properties. The primary purpose of prescribing prednisone is to reduce inflammation and suppress the immune system. This makes it an effective treatment for conditions such as autoimmune disorders, e.g., rheumatoid arthritis, lupus, respiratory conditions, e.g., asthma, COPD exacerbations, allergic reactions, certain types of cancer, inflammatory bowel diseases, e.g., Crohn's disease, ulcerative colitis. Prednisone is often prescribed as a short-term treatment, and a 5-day dosage regimen is a common approach for managing acute flare-ups or exacerbations of various conditions. Understanding the 5-day prednisone dosage. A 5-day prednisone dosage is a short-term course of treatment that involves taking a specific dose of prednisone for 5 consecutive days. The dosage and schedule may vary depending on the condition being treated and the individual's response to the medication. Typically, a higher dose of prednisone is prescribed on the first day, followed by a gradual tapering of the dose over the remaining 4 days. This approach helps to achieve a rapid therapeutic effect while minimizing potential side effects associated with prolonged use of high doses. Here's an example of a common 5-day prednisone dosage schedule. Day 1 to 60 mg, Day 2 40 mg, Day 3 30 mg, Day 4 20 mg, Day 5 10 mg. It's important to note that the specific dosage and schedule may vary based on your individual circumstances and the recommendation of your healthcare provider. Benefits and potential side effects of a 5-day prednisone dosage. The primary benefit of a 5-day prednisone dosage is its ability to quickly and effectively reduce inflammation and suppress the immune system. This can provide relief from symptoms associated with various conditions, such as reduced joint pain and swelling in autoimmune disorders, improved breathing in respiratory conditions, alleviation of allergic reactions, reduced inflammation in inflammatory bowel diseases. However, like any medication, prednisone can also cause side effects, especially with prolonged use or high doses. The potential side effects of a 5-day prednisone dosage may include increased appetite and weight gain, insomnia or sleep disturbances, mood changes, e.g., irritability, anxiety, elevated blood sugar levels, stomach upset or indigestion, fluid retention and swelling. It's essential to be aware of these potential side effects and discuss them with your healthcare provider before starting the treatment. How to optimize your treatment with a 5-day prednisone dosage. To maximize the benefits and minimize the potential side effects of a 5-day prednisone dosage, there are several steps you can take. Follow the prescribed dosage schedule carefully. Adhering to the recommended dosage and schedule is crucial for achieving the desired therapeutic effect and minimizing side effects. Stay hydrated. Drinking plenty of fluids can help reduce the risk of fluid retention and swelling, which are common side effects of prednisone. Maintain a balanced diet. While prednisone can increase your appetite, it's important to focus on consuming a well-balanced diet rich in nutrients. Avoid excessive intake of high-calorie, high-fat, or high-sodium foods. Engage in regular physical activity. Moderate exercise can help counteract the potential weight gain and mood changes associated with prednisone use. However, it's essential to consult with your healthcare provider before starting or modifying an exercise routine. Take the medication with food. Prednisone can cause stomach upset, so it's recommended to take the medication with food or a snack to minimize this side effect. Monitor your blood sugar levels. Prednisone can elevate blood sugar levels, so it's important to monitor your levels closely, especially if you have diabetes or are at risk for developing it. Communicate with your healthcare provider. If you experience any concerning side effects or have questions about your treatment, don't hesitate to reach out to your healthcare provider for guidance and support. Tips for managing potential side effects during the treatment. While a 5-day prednisone dosage is generally well tolerated, some individuals may experience side effects. Here are some tips to help manage potential side effects. Insomnia or sleep disturbances. If you experience difficulty sleeping, avoid caffeine and stimulating activities close to bedtime. Establish a relaxing bedtime routine and consider using over-the-counter sleep aids if necessary. Mood changes. Be aware of potential mood swings or irritability, and practice stress management techniques such as deep breathing exercises, meditation, or yoga. Increased appetite and weight gain. Plan your meals in advance and focus on nutrient-dense foods. Engage in regular physical activity to help manage your weight. stomach upset or indigestion. Take prednisone with food or a snack, and consider using over-the-counter antacids if needed. Fluid retention and swelling. Limit your sodium intake, stay hydrated, and consider wearing compression stockings or elevating your legs to alleviate swelling. Remember, if any side effects become severe or concerning, it's essential to contact your healthcare provider for further guidance and potential adjustments to your treatment plan. Important precautions and considerations when taking a 5-day prednisone dosage. While a 5-day prednisone dosage is generally considered safe and effective, there are some important precautions and considerations to keep in mind. Interactions with other medications. Prednisone can interact with certain medications, including blood thinners, diabetes medications, and certain antibiotics. Be sure to inform your healthcare provider about all the medications and supplements you are taking. Existing medical conditions. Individuals with certain medical conditions, such as diabetes, high blood pressure, or osteoporosis, may require closer monitoring or dosage adjustments when taking prednisone. Pregnancy and breastfeeding. Prednisone should be used with caution during pregnancy and breastfeeding, as it can potentially affect the developing fetus or pass through breast milk. Consult with your healthcare provider about the risks and benefits. Tapering off the medication. It's important not to abruptly stop taking prednisone after a 5-day course, as this can lead to withdrawal symptoms. Your healthcare provider may recommend a gradual tapering schedule to minimize the risk of adverse effects. Monitoring for potential side effects. Be vigilant in monitoring for any potential side effects, and report any concerns to your healthcare provider promptly. By following your healthcare provider's instructions and being aware of these precautions, you can help ensure a safe and effective treatment with a 5-day prednisone dosage. Frequently asked questions about a 5-day prednisone dosage. How long does it take for prednisone to start working? Prednisone typically starts working within a few hours to a day after taking the first dose. However, the full therapeutic effects may not be realized until after a few days of consistent use. Can I drink alcohol while taking a 5-day prednisone dosage? It's generally recommended to avoid or limit alcohol consumption while taking prednisone, as it can increase the risk of certain side effects, such as stomach irritation and fluid retention. Will I experience withdrawal symptoms after completing a 5-day prednisone dosage? While a 5-day course is relatively short, some individuals may experience mild withdrawal symptoms, such as fatigue, muscle aches, or joint pain. These symptoms are typically temporary and should resolve within a few days. Can I take over-the-counter medications while on a 5-day prednisone dosage? It's important to consult with your healthcare provider before taking any over-the-counter medications, as some may interact with prednisone or exacerbate potential side effects. How long should I wait before starting another course of prednisone? The recommended duration between prednisone courses can vary depending on the condition being treated and your individual circumstances. It's essential to follow your healthcare provider's guidance regarding the timing and frequency of prednisone use. Alternatives to a 5-day prednisone dosage. While a 5-day prednisone dosage is a common and effective treatment approach, it may not be suitable for everyone. In some cases, your healthcare provider may recommend alternative treatments or dosage regimens, such as longer or shorter prednisone courses. Depending on the severity of your condition and your response to the medication, your healthcare provider may prescribe a longer or shorter course of prednisone. Other corticosteroid medications. Alternative corticosteroid medications, such as hydrocortisone or methylprednisolone, may be prescribed instead of prednisone, particularly if you experience significant side effects or have specific medical conditions. Non-steroidal anti-inflammatory drugs, NSAIDs, for certain conditions, such as arthritis or other inflammatory conditions, your healthcare provider may recommend using NSAIDs as an alternative or in combination with prednisone. Disease-modifying antirheumatic drugs, DMARDs, for autoimmune disorders like rheumatoid arthritis. DMARDs may be prescribed to help manage the underlying condition and reduce the need for corticosteroids like prednisone. Biologic therapies. In some cases, biologic medications that target specific components of the immune system may be recommended as an alternative or complementary treatment to prednisone. It's important to have an open discussion with your healthcare provider about the available treatment options and to weigh the potential benefits and risks of each approach based on your individual circumstances. Talking to your doctor about a 5-day prednisone dosage. Effective communication with your healthcare provider is essential when it comes to any medical treatment, including a 5-day prednisone dosage. Here are some tips for having a productive conversation with your doctor. Prepare a list of questions. Before your appointment, make a list of any questions or concerns you have about the 5-day prednisone dosage, such as potential side effects, interactions with other medications, or alternative treatment options. Discuss your medical history and current medications. Be sure to provide your healthcare provider with a complete medical history, including any existing conditions, allergies, and medications, prescription, over-the-counter, and supplements you are currently taking. Express any concerns or preferences. If you have any specific concerns or preferences regarding the treatment, such as a desire to minimize potential side effects or a preference for alternative therapies, be open and honest with your healthcare provider. Understand the treatment plan. Ask your healthcare provider to explain the rationale behind prescribing a 5-day prednisone dosage, the expected benefits, and the potential risks or side effects. Ensure you understand the dosage schedule and any special instructions. Discuss follow-up and monitoring. Find out how your healthcare provider plans to monitor your progress and any potential side effects during and after the 5-day prednisone dosage. Inquire about when and how to report any concerns or adverse effects. Consider seeking a second opinion. If you have any lingering doubts or concerns about the recommended treatment plan, don't hesitate to seek a second opinion from another qualified healthcare provider. By having an open and honest dialogue with your healthcare provider, you can make informed decisions about your treatment and ensure that your concerns and preferences are taken into consideration. Conclusion: a 5-day prednisone dosage is a common and effective treatment approach for managing various inflammatory and autoimmune conditions. By understanding the benefits, potential side effects, and proper usage guidelines, you can optimize your treatment and minimize any potential risks. Remember, effective communication with your healthcare provider is crucial throughout the treatment process. Don't hesitate to ask questions, express concerns, or discuss alternative treatment options if needed. By following your healthcare provider's instructions, monitoring for potential side effects, and making lifestyle modifications as recommended, you can maximize the benefits of a 5-day prednisone dosage and achieve better management of your condition. If you're considering a 5-day prednisone dosage or have any questions or concerns about your treatment plan, don't hesitate to schedule a consultation with one of our experienced healthcare providers. We're here to provide personalized guidance and support to help you achieve optimal health and well-being.